Hi everyone, so welcome back to Wednesday Reading Live. This is May Vandana PS joining you from Needus Academy. Alright, so how's your day? So let me check how many of you have joined this live session. Okay, then I'll give you the material, a sample question. Yes. Okay. Yes, Reshma, good afternoon, dear. Okay. So, I'll give you a sample question from part B. So, please do this material. Okay. Please read it carefully and understand. Just find out the answer for the question. So, I'll give you 2 minutes for this question. So, here comes the question. All right. So have you all done this question? Okay. Yes, Reshma, Jissa, good afternoon. Good afternoon, everyone. All right. So before moving to this question, let me introduce you or let me give you some examples or details about part B. Okay, example in the sense, yeah, this is one of the example, sample question. Okay, so what do you know about part B? നിങ്ങൾക്ക് പാർട്ട് ബിനെ പറ്റി എന്താ അറിയാം? ലെറ്റ് മീ നോ ഇൻ ദ കമന്റ് ബോക്സ്. വാട്ട് ഡു യു നോ അബൌട്ട് പാർട്ട് ബി? യെസ്, റോഷ്ന, വർഷ, അനു, ഹായ്, ഗുഡ് ആഫ്റ്റർനൂൺ. സോ വാട്ട് ഡു യു നോ അബൌട്ട് പാർട്ട് ബി? ഒന്ന് കമന്റ് ചെയ്യാമോ? എത്ര ക്വസ്റ്റ്യൻസ് ഉണ്ടാവും? എന്ത് ടൈപ്പ് ഓഫ് ക്വസ്റ്റ്യൻ ആണ്? വാട്ട് ഈസ് ദ സ്ട്രാറ്റജി വി ആർ യൂസിങ്? വാട്ട് അബൌട്ട് ദ കാറ്റഗറി ഓഫ് ക്വസ്റ്റ്യൻസ്? ഓക്കെ, സോ പ്ലീസ് ലെറ്റ് മീ നോ ഇൻ ദ കമന്റ് ബോക്സ്. വാട്ട് ഡു യു നോ അബൌട്ട് പാർട്ട് ബി? നിങ്ങൾക്ക് എന്തറിയാം പാർട്ട് ബിനെ പറ്റി? യെസ്, ഹായ് റിനു, ഗുഡ് ആഫ്റ്റർനൂൺ ഡിയർ. Okay, Jissa, 6 questions will be there in part B. So total number of questions, it is 6 questions. Okay, very good. Okay, Riba, 6 questions, elimination method. So the strategy we are using, it is elimination. Okay, I'll show you what is elimination then. Okay, then, okay, Roshna, 6 questions with 3 answer options. So, the type of question which is called multiple choice questions with 3 answer options. Okay, so multiple choice questions with 3 answer options. Okay. Okay, Joshna, 6 questions will be there. Okay, Reba, very good. 12 minutes. Okay, if you are an excellent reader, then the time that you will take, which will be only 10 minutes. Okay, that original, I mean, the normal time is 12 minutes, I know, but through practice, you can do part B within 10 minutes. Okay, so 10 to 12 minutes, I can say 10 to 12 minutes. Okay. Okay, I know 6 questions will be there. Use elimination method. Okay, Jissa, elimination method. Hi, Mithun, good afternoon. Okay, Reba, 3 categories will be there. Guideline, manual, policy, email, memo, notice. Very good, dear. And we have 3 category of questions. Okay, so which are the category? Already Reba commented it. But still, I'll explain what are the 3 categories. So the first category, okay, among these 3 category, the first one, which is guidelines. Okay, so what are guidelines? Guidelines and you know that guidelines, which means set of rules and regulations. Okay, so someone has to follow that. Bandhamayattum follow cheyanda korchu set of rules and regulations aayirikkum. It will be in a guideline. Okay, for example, hospital guidelines. Okay, so the staff should follow all those guidelines of the hospital, right? Then second category, guideline aanengil which sentence is important? For example, idoru guideline aanu vicharikka. Suppose this is a guideline. So which sentence is important? I can say the first sentence is important. Okay, first sentence answer aanu ennalla njan parayunnu. First sentence will be important. Okay, and second category, it is manual or policy. So what is a manual? Manual, which means it contains all the information about a particular instrument or instrument in a patio or a device, equipment, machine or drugs, medicine patiyokkulla informations aayirikkum. And there is no, I can say, there will not be any connections with patients, staffs or any animals. Okay, karanam the connection illa ennu njan uddeshikkunnathu, that means if it is all about a medicine, what is the speciality of the medicine, that will be in this manual. Okay, adinte speciality aayirikkum, not about the patient. Okay, so that's called manual. And what is a policy? What is the difference between guideline and policy? എപ്പോഴും വരുന്ന ഒരു കൺഫ്യൂഷൻ ആണ്, എന്താണ് ഗൈഡ്ലൈൻ പോളിസി തമ്മിലുള്ള ഡിഫറൻസ്? ഓക്കെ, വാട്ട് ഇസ് ദ ഡിഫറൻസ് ബിറ്റ്വീൻ എ ഗൈഡ്ലൈൻ ആൻഡ് എ പോളിസി? സോ ഗൈഡ്ലൈൻ, ഓൾറെഡി ഐ ഹവ് മെൻഷൻഡ്, ഇറ്റ് ഇസ് റിലേറ്റഡ് ടു ഹോസ്പിറ്റൽ ഗൈഡ്ലൈൻസ്, റൂൾസ് ആൻഡ് റെഗുലേഷൻസ്, instructions. When it comes to policy, that can be connected with more, it is related to government policies. Okay, so all the hospitals should follow the government policies. All the staff should follow the government policies. So policies are a little bit more related to government. Okay, and what are what is the next category, the third category? It is either a email, then memo or notices. Okay, so likewise we have 3 different categories in part B. Okay, so that's that. If it is a guideline, what are you reading for in a guideline? We are reading for the details. If it is a manual or policy, we are reading for the main idea. And if it is the third category, email, memo or notice, we are reading for the purpose. Clear or no? Okay. Yes. So a lot of comments here. That means you guys know about part B, right? Yeah. Okay. Okay, Reshma, 6 questions will be there, 12 minutes. Each one have one extraction, 3 categories. Okay, extracts and one extract will be there. Okay, Roshna, guideline, manual, email, memo, notice. Okay, dear, it's not manual or extract, manual or policy. Okay, Anu, category, guideline, manual or policy, email, memo, notice. Very good. Okay, Anu. Anu Elias, guideline, we look for principles. Yeah, set of principles, set of rules and regulations or instructions. Okay, Riba, first sentence is important in a guideline. Okay, Reshma, guideline, manual, extract, email, notice. Idea. Very good. Okay, Sulega, guideline, first sentence is important. Manual, we look for main idea. Very good, yes. Okay, Roshna, no connection with animals or human beings. Yeah, if it is a policy or a manual, yeah. Okay, Jissa, guideline, manual or policy, memo. A small mistake, dear. Guidelines, manual or policy, email, memo or notice. Okay, that is the third category. Okay, Jessica, manual, policy, main idea. Very good, yes, Suleka. Okay, Roshna, more formal, yeah. Emails, memos are a little bit more formal than emails, yeah. Then, yeah, a lot of idea. Okay, guideline, first sentence is important, reading for identifying the details. Okay, Reno, guideline, set of rules and regulations someone has to follow. Manual and policy, it is a small booklet, device, okay. Machines, equipment, instruments, medicine, very good, dear. Then comes email, memo or notices, yes. Okay. Then details, which means set of rules and regulations. So we are reading for the details. What is the details mentioned there? And main idea, which means what is the speciality of this device? Feature. So likewise, we are reading for the main idea of the machine or this particular act from the policy. And if it is the third category, then we are reading for the purpose. Purpose, which means the overall idea. That overall idea of the text. Okay, so likewise, that will be that. Then coming to the question, the category. The extract states that abnormalities in babies born to mothers who took salbutamol are. So can you tell me, already I have explained to you what are the 3 categories. So can you please tell me in the comment box which category of this question, in which category this question falls under. This question is category. Hi Delighta, good afternoon dear. Yes. So in which category the question falls under? The category la question vera. Extract states that abnormalities in babies born to mothers who took salbutamol are. Okay. Okay, Varsha. Okay, Reshma. Yeah. I'll tell you in which category. Finally, last time I am the category. Okay. So extract states that abnormalities in babies born to mothers who took salbutamol are. So my keywords from the question: abnormalities, then babies, salbutamol. Okay, salbutamol is actually a medicine, a drug. Okay, so I'm connecting with the first option, relatively infrequent. So my only keyword is infrequent. And option B, clearly unrelated to its use. So unrelated. And option C, caused by a combination of drugs. So my keywords are combination drugs. Okay. So what was the question? Question in that, no? Abnormalities in babies born to mothers who took salbutamol are. Salbutamol edukkunna mothers in the karya. Okay. Extract from a monograph, salbutamol sulfate inhalation aerosol. Okay. Pregnant women. Salbutamol has been in widespread use for many years in humans without apparent ill consequence. However, there are no adequate and well-controlled studies in pregnant women, and there is little published evidence, little which means no. Okay, published evidence, its safety in early stages of human pregnancy. Appo adine patti endha we don't have any evidence about its efficiency, adinte benefits onnum namukku ariyilla. Then administration of any drug to pregnant women should only be considered if the anticipated benefits to the expectant women are greater than any possible risk of the fetus. Okay, so it's not about the medicine, it's all about other medications. Then, during worldwide marketing experience, rare cases of various congenital anomalies, including cleft palate lymph defects, have been reported in the offspring of patients being treated with salbutamol. Appo salbutamol edukkunna mothers and children, അല്ലെങ്കിൽ babies, അവർക്ക് എന്ത് പ്രോബ്ലം ആണ്? So there is problems with congenital anomalies, including cleft palate and lymph defects will be there. ഇതാണ് വരാൻ പോകുന്ന chances of risk. Okay, ഇനി some of the mothers were taking multiple medications during their pregnancies. ഇതല്ലാതെ, other than salbutamol, mothers are taking other medications. Because no consistent pattern of defects, okay, can be discern ചെയ്യാൻ പറഞ്ഞാൽ identify ചെയ്യാം. Okay, or noticed. Okay, noticed. A relationship with salbutamol use cannot be established. Okay, salbutamol use ചെയ്ത് എന്താണ് കുഴപ്പം? അല്ലെങ്കിൽ എന്താണ്? There is no consistent pattern of defects will be there. ഒരു frequent ആയിട്ടുള്ള അല്ലെങ്കിൽ ഒരു continuous ആയിട്ടുള്ള defects ഇല്ല. Okay, defects ഇല്ലെന്നല്ല പറയുന്നത്, there is no defects എന്നല്ല, there are defects, these are the defects. Okay, but there is no consistent pattern of defects. So now tell me, in which category the question falls under? ഇത് ഏത് category ആണ്? Okay, yes, Varsha, guidelines, Reshma, Anu, Roshna, Jissa, Neetu, Reenu. Okay, you guys are saying it is a manual, and Sharon, it's a guideline. Okay, so actually this is a manual. Okay, so this is a manual. Why? This is all about a particular medicine. ഇതൊരു മെഡിസിനെ പറ്റിയാണ്. Okay, guidelines ഞാൻ പറഞ്ഞു, set of rules and regulations ആയിരിക്കും. Nothing mentioned about any set of principles or rules and regulations. So this is all about this particular medicine. That means ഇതൊരു manual ആണ്. Okay, this is a manual. Then now tell me, which is the correct answer through elimination? Eliminate ചെയ്യുമ്പോൾ ഏത് ആൻസർ നമുക്ക് കിട്ടുക? Which is the correct answer here? Okay, Thomas, it's not a guideline here. Actually, this is a manual, okay, because it's all about a medicine, salbutamol. Okay, so what is your answer? Let me know, please. Okay, Varsha, your option is C. Okay, any other answers? Where ഏതെങ്കിലും answers ഉണ്ടോ other than option C? Other than option C, do you have any other answers? Where ഏതെങ്കിലും answers ഉണ്ടോ? Option C. Okay. Why option C? Option B. Okay. Okay. So option C in the caused by a combination of drugs. Okay, caused by a combination of drugs. Question മറന്നു പോരുത്. What is the question? Abnormalities in babies born to mothers who took salbutamol are caused by a combination of drugs. Combination of drugs use ചെയ്യുന്നതുകൊണ്ടാണോ ഈ പറയുന്ന abnormalities വരുന്നത്? Where is it mentioned? Where is it mentioned? This is because of, or this deformities അല്ലെങ്കിൽ risk factors, abnormalities are because of the combination of drugs. അതെവിടെയാണ് പറയുന്നത്? Combination of drugs കാരണമാണ് ഈ പറയുന്ന കാര്യങ്ങൾ വരുന്നത്. Where is it mentioned? Not mentioned. Okay, so see, the first reason is that it is not mentioned anywhere that these deformities or these abnormalities are because of combination of medicines. Okay, second reason is that question is not about other medicines. Question is all about this particular medicine, salbutamol. അതിന്റെ കാര്യം മാത്രമേ ഉള്ളൂ. Okay, so we can eliminate option C, not mentioned anywhere. I can say not mentioned. Okay, and what about option B? Clearly unrelated to its use. അതായത് ഇതിന് ഒരു എന്താ പറയുക അബ്നോർമാലിറ്റീസ് ഇല്ല എന്ന് നമുക്ക് പറയാൻ പറ്റുമോ? ക്ലിയർലി അൺറിലേറ്റഡ് ആണോ? See this line. During worldwide marketing experience, rare cases of various congenital anomalies, including cleft palate and lymph defects, have been reported in the offspring of patients being treated with salbutamol എന്ന് പറയുന്നത്. അപ്പോൾ പിന്നെ clearly unrelated to its use എന്ന് പറയാൻ പറ്റുമോ? It is contradictory option or opposite option. Answer is option A. There are defects but it is not consistent. അതായത് കണ്ടിന്യൂസ് ആയിട്ടൊരു ഡിഫക്റ്റ് ഇല്ല. ഓക്കെ, സീ ദ ലാസ്റ്റ് ലൈൻസ്. ബിക്കോസ് നോ കൺസിസ്റ്റന്റ് പാറ്റേൺ, ദാറ്റ് മീൻസ് ഇൻഫ്രീക്വന്റ്, നോട്ട് ഫ്രീക്വന്റ്. ഓക്കെ, ഓഫ് ഡിഫക്ട്സ് ക്യാൻ ബി നോട്ടിഫൈഡ് ഓർ നോട്ടിസ്ഡ്, ഡിസേൺഡ്. ദാറ്റ് മീൻസ് ആൻസർ ഇസ് ഓപ്ഷൻ എ, റിലേറ്റീവ്ലി നോട്ട് ഫ്രീക്വന്റ് or relatively infrequent. Clear? Any doubts? Okay, Dar Mohsin, it's option A. Very good, dear. Yes, Delighta, very good. Correct answer, option A. Okay, Neetu, Sulega, excellent. Okay, that's option A. Clear? I hope it is clear. Okay, it was a little bit confusing, I know, but this is the correct answer. Okay, so now we are moving to the important part, which is part A. Okay. Yes, okay, Varsha. Okay, dear. Yes, so what about part A? ഇനി പാർട്ടിനെ പറ്റി നമുക്ക് എന്തൊക്കെ കാര്യങ്ങളാണ് ഡിസ്കസ് ചെയ്യണ്ടേ? So what do you know about part A? Before moving to these questions, let me talk about part A. Okay, you are confused. Okay, still you are confused? ഇപ്പോഴും കൺഫ്യൂസ്ഡ് ആണോ രേഷ്മ? ക്ലിയർ ആണോ? Okay. Yes. Okay, okay, dear. Yes, thank you. Anyway, yeah, coming to part A. So what do you know about part A? എന്ത് കാര്യങ്ങൾ നിങ്ങൾക്ക് പാർട്ടിനെ പറ്റി അറിയാം? Let's start with the time. Okay, what about the timing, number of questions, then type of questions, what strategy we are using here? Okay, yes. So what do you know about part A? ഈ മെറ്റീരിയൽ കുറച്ചും കൂടെ ഡിഫിക്കൽട്ട് ആണ് when you compare with the previous one. ഇന്നലത്തെ മെറ്റീരിയൽ it is very easy and yeah, it is also very easy but little bit difficult than the previous one. Okay. Okay. So starting with strategy now we will start here. Okay, fine. So what is the strategy we are using? It's called skimming and scanning. Okay, yes. In the number of questions, okay, 20 questions, then time, okay, 15 minutes. 15 minutes. Anything else? Anything undo? About part A, skimming and scanning method ആണ് യൂസ് ചെയ്യുന്നത്. 20 questions ഉണ്ടാവും, 15 minutes. Anything else? Okay, so yes, what is skimming and scanning? Skimming എന്താ? What is skimming and scanning? So ഇന്ന് നമുക്ക് skimming and scanning explain ചെയ്യുന്നതിന് പകരം I'll show you what is skimming and scanning. Okay, so let's see what is skimming and scanning. So I'm just reading the paragraph and I'm going to underline certain words from each of the text. Okay, so 20 questions on down and 20 questions will be like 1 to 7 set of questions in the match the following. Okay, then 8 to 14 short answer questions and 15 to 20 it is fill in the blanks. Okay, so ingeneyaanu yes questions. Okay, so that's that. So now let's do skimming and scanning. Okay, appo njan vaayikam, I'll read the part, I'll read each of the text, but please let me know what are your keywords from each of the text. Okay, appo ningal text A mark cheya, then tell me what are the keywords from text A, then text B, text C and text D. Okay, if any corrections I'll correct you, endengilum mistakes ondengil I'll correct you. So please let me know what are your keywords from A, B, C and D. It is very important, so please do comment. Okay, yeah. Okay, Aisha, fast reading. Okay, Reba, quick reading and searching for important words. Okay, Tinsi, underline heading and subheading. Okay, Reba, 1 to 7 match the following, then 8 to 14 short answer questions and 15 to 20 fill in the blanks. All right, underline keywords and okay, from each extent. Okay, Reshma. Okay, Asha, fast reading. Okay, match the following, fill in the blanks, answer in one word. Oh, okay, yeah. Okay, so please let me know, I'll read. So please let me know what are the keywords, okay? So text A, gallstones are hardened, concentrated pieces of bile that form in your gallbladder or bile ducts. Gall means bile, so gallstones are bile stones. Your gallbladder is your bile bladder. It holds and stores bile for later use. Your liver makes bile and your bile ducts carry it in different organs in your biliary tract. Healthcare provider, so it is very important. Why? Names. Okay, but for example, healthcare providers, people, doctor, staff, patient, it is very important to mark it. Okay. Sometimes use the term cholelithiasis to describe the condition of having gallstones. Chole, which means bile, and lithiasis means stone forming. Gallstones form when bile sediment collects and crystallizes. At least 10% of US adults have gallstones. Okay. Then, typical gallstone pain is sudden and severe and may make you sick to your stomach. This is called gallstone attack or gallbladder attack. You might feel it most severely after eating. When your gallbladder contracts, creating more pressure in your biliary system, it may wake up from sleep. So, these are my keywords from text A. Okay, so what about you guys? Ningalde keywords enda? Type cheyyunnunno. So, what are the keywords from text A? Keywords onnu ille. Okay, so what are the keywords from text A? Okay, I'll read text B, so please let me know. Okay, then risk factors. So this is a subtitle, so risk factors. Age, hormones, weight, genetics. Then gallstones take time to develop and grow large enough to cause obstruction. Men and people assigned male at birth are more likely to get them after age 60. Women and people, that is AFAB, are more likely to get during their fertile years, roughly between ages 20 and 50. Then women and people AFB are 3 times more likely to get gallstones than men and people AMAB. Their risk peaks declines with their estrogen and progesterone levels. Estrogen increases cholesterol levels and progesterone slows your gallbladder from emptying. Weight, body fat releases estrogen. So having more of it raises your estrogen levels and cholesterol levels. On other hand, rapid weight loss, like after weight loss surgery, can also cause gallstones. Losing body weight fat quickly releases large loads of cholesterol into your bile. Then genetics, if you are of Native American or Mexican descent, your genetic profile makes you more prone to higher cholesterol levels in your bile, leading to gallstones. If you have a family history of gallstones, you may be more likely to develop them regardless of your racial heritage. Okay, so that's all about text B. So now text C, complications. So what are the complications? A small number of people with gallstones may develop serious problems. It can help if gallstones cause a severe blockage. It can also happen if they move into another part of your digestive system. In some cases, gallstone disease, a bile duct can become permanently blocked. This can lead to buildup of bile inside the gallbladder. This can cause the gallbladder to become infected and inflamed. The medical name for inflammation of the gallbladder is acute cholecystis. If a gallstone passes out of the gallbladder into the bile duct and blocks the flow of bile, jaundice occurs. If the bile ducts become blocked, bacteria can infect them. The medical term for bile duct infection is acute cholangitis. Acute pancreatitis can develop when a gallstone blocks the opening of the pancreas. This will cause it to become inflamed. Gallbladder cancer is rare, but it's very serious complication of gallstones. A history of gallstones increase your risk of developing gallbladder cancer. About 4 out of every 5 people who have cancer of the gallbladder also have a history of gallstones. Another rare but serious complication of gallstones is gall ileus. This is where the bowel becomes blocked by a gallstone. Okay, and text D, it's all about the treatment. So here we have a diagram, a pictorial is here, management of gallstones. So what are the management options? Gallstones identified, symptomatic, if it is yes or no, medical management is there. Then non-steroidal anti-inflammatory drugs or necrotic pain relievers are there. If it is no, indications for surgical treatment, then elective LC, clinical follow-up will be there. Candidate for surgery, yeah, candidates details mentioned here. If it is yes, LC or without ERCP. Mild symptoms, radiolucent stones, gallbladder function. Okay. Then cholelithiasis, ERCP, LC, acute cholecystis, LC within 72 hours, LC before discharge. Yes. Then oral dissolution therapy. Yeah, a lot of therapies mentioned, therapy. Okay, and also the bracket. Anything else? Radio-opaque gallstones, clinical management, emergency LC, follow-up. Yes. And what about the last one? Exceptions. Exceptional cases in the expectant management include patients with calcification of the gallstones, yeah, gallbladder, anemia, large stones greater than 3 centimeter. Yeah, so that's all about that, bariatric surgery. Okay. Native Americans and transplant, yeah. So that's all about my keywords from text D. Okay. And I hope you don't have any keywords, right? Okay, it's okay. Okay, so my first question, candidates that are disentitled for the treatment of gallstones. Okay, so my keywords, candidates, disentitled, treatment. Okay, so please let me know your answer, any answer? And the answer, first one. Hi Lino, good afternoon dear. Yes, so candidates that are disentitled for the treatment of gallstones. Disentitled, which means they are not eligible. Okay, ineligible, yeah, ineligible. Candidates that are disentitled or ineligible for the treatment of gallstones. Okay, so without even see. So this is the benefit of reading, fast reading. So already we have read this paragraph. Treatment is mentioned in text D. Candidates mentioned in text D. Ineligible mentioned in text D. So answer is D. Okay, so which is from text D. Candidates for surgery. If it is yes, if it is no. Okay, so that's from text D. It's all about the treatment. So answer is D. Second question. Yes, Sulega and Reshma. Very good. Answer is correct. Okay. Second question. Integration between gallstones and jaundice. So integration, that means link. Gallstones, jaundice. So what about that one? Gallstones, jaundice mentioned everywhere. Everywhere we can do the word jaundice. So answer is from, yes, text CC. Already I mark that. So jaundice as well as gallstones. So it's mentioned here in text C, the relation between gallstones and jaundice. So answer is from C. Very good. Yes, Reshma, correct answer. It's from C. Third one, what is the preponderance? That means prevalence of gallbladder cancer. Every day I mentioned the preponderance of the condition. Yes. Okay, Reshma, it's a second question which is from C. Yes, Sulega, yes, Lini, it is from C. Very good. What about third question? Prevalence of the condition, spreadness of the condition or preponderance. Okay, Anila. Yeah, so third one, which is from text C. So where is it mentioned, text C? Preponderance of gallbladder disorder, cancer. Yeah, so that is also mentioned in text C. A small number of people with gallstones may develop serious problems. So it's all about text C. Prevalence, okay, preponderance. So it's from C. It's not from A, dear. Actually, it is from text C. A actually at least 10% of US adults have gallstones on. At least, maybe. Okay, so here it is mentioned very clearly. See, a small number of people with gallstones may develop serious problems, and rest of it's all about the prevalence of the condition. A preponderance it is in text C. Okay, so that means text C. And fourth one, how does typical gallstones pain feel like? So typical, that means usual or common. Then pain and gallstone. What about fourth one? Yes, okay, Lini and John. Yes, third one is text C. Okay, what about fourth one? Very good, yes. Fourth one, which is from text A. Okay, pain. So where is it mentioned about the severe pain? Typical gallstone pain is sudden and severe. See the last para? So answer is from text A. And fifth one, when do gallstones become frequent in males? So gallstones, frequent males. Okay, yes, Anila, Lini. Okay, Neetu. Third one, text C. Okay, dear. Fourth one, Yes, Reshma, it is text A. Yeah. So what about fifth one? Fifth question. Okay, Lini, yes, it is text A, fourth one. Okay, John, text A, fourth one. Okay, Zulega, fourth one, text A. Okay, Reshma, fifth one, it is from text B. So why it is text B? Gallstones become frequent in males. Where is it mentioned in text B? It is in males. Where is it mentioned? It is in males. Okay, so men and people assigned male at birth more likely to get them after 60. So that means answer is B. Okay, yes, yes. Very good, very good. Yes, Jissa, it is in the first line. Excellent, dear. And sixth one, a connotation of alternative title of gallstones. Connotation, alternative title. So what is another name for gallstones? Any other name? അല്ലെങ്കിൽ എന്താ പറയുക അതിൻ്റെ ഡിസ്ക്രിപ്ഷൻ എവിടെയാണ് കൊടുത്തിരിക്കുന്നത്? യെസ്, ഓക്കെ ജോൺ, വെരി ഗുഡ്. യെസ്, ഏജ് ആണ് മെൻഷൻ ചെയ്തിരിക്കുന്നത്. ഇറ്റ് ഇസ് ഇൻ ടെക്സ്റ്റ് ബി. ഓക്കെ നീതു, ഫിഫ്ത്ത് വൺ ടെക്സ്റ്റ് ബി. യെസ് ജോൺ, ടെക്സ്റ്റ് ബി. ഓക്കെ, വാട്ട് അബൌട്ട് സിക്സ്ത് ക്വസ്റ്റ്യൻ? കൊണോട്ടേഷൻ ഓഫ് alternative title of gallstones. Okay, yeah, it's from text A. Yes, so healthcare providers sometimes use the term cholelithiasis. Yes, so that means it's from A. And what about seventh one? How does ethnicity become a factor for gallstones? This is confusing, but still, if you have marked keywords correctly, your answer will be correct. Okay, yeah. So what about seventh one? Okay, yes, do you know meaning? Yes, sixth one, which means the meaning. Yes. Okay, John, text A. Okay, Lini, it is from text A. Okay, Sulega, text A. So what about seventh one, guys? Yeah, seventh one, very good, Reshma. Answer is correct, which is B. Okay, so where is this ethnicity mentioned in text B? Ethnicity of the text B. Okay, so that is from racial heritage, genetics, Native American or Mexican descent. That means connected with ethnicity. Okay, so answer will be text B. Clear? I hope it is clear. Now 8 to 14, yes, genetics. Very good, Reshma. Correct or not? Okay, 8 to 14, short answer questions. The organ that generates bile or produces bile. Organ generates bile. Which is that organ? Yes, very good, Sulekha. Seventh one is B. Oh, excellent, Renu. 7 out of 7. Okay, Reshma, 7 out of 7. Very good. Oh, all right, Delighta, it's 7 out of 7. Good enough. Anyone else with 7 out of 7? Okay. So it's 8th question. Okay, Linu, very good, dear. Yes. Okay. So what about 8th one? Organ that generates bile, produces bile. Which is that organ that produces bile? Which organ ആണ്? Yes, answer is liver. Okay, from which text? From text A. Yes, answer is liver. Your liver makes bile. See? Okay, your liver makes bile, produces bile. So answer is liver. Then 9th one. Short answer ചെയ്യുമ്പോൾ എപ്പോഴും ശ്രദ്ധിക്കുക, ആൻസർ ടു ദ ക്വസ്റ്റ്യൻ ചോദിച്ചിരിക്കുന്നതിന് മാത്രം ആൻസർ കൊടുത്താൽ മതി. ഡോണ്ട് ആഡ് എനിത്തിങ് എൽസ്. ഓക്കെ, 9th one, when should one have to undergo LC after being confirmed with acute cholecystis? So acute cholecystis, LC, yeah, these are my keywords, confirmed also. So when should, so when എന്ന് പറയുമ്പോൾ തന്നെ അറിയാം, we need the time, സമയമാണ് അറിയേണ്ടത് അല്ലേ? Okay, Midhun, very good, it's liver. Yes. Okay, Jissa, liver. Yes, John, Matthew, Sulega, liver ആണ്, correct ആണ്. So what about 9th one? എത്ര time ആണ്? What about the timing mentioned there? When should one have to undergo LC? What about the time? Okay, ഞാൻ ചോദിക്കട്ടെ, is it 72 hours or 72 hours ആണോ വരിക, or within 72 hours? Which one is correct? ഏതാ കറക്റ്റ്? വിത്തിൻ അവിടെ ഉണ്ടോ? വിത്തിൻ 72 hours. Yes. എല്ലാവരും കമൻറ്റ് ചെയ്തേക്കുന്നത് 72 hours ആണ്. ബിനില, രേഷ്മ, ലിനു, ജീന, സ്റ്റാർ, ഡിലൈറ്റ. Okay, 72 hours. So please let me know, is it 72 hours or within 72 hours? Yes, very good, Jissa. It is actually within 72 hours. Answer within 72 hours. When should one have to undergo LC? After being confirmed with acute cholecystis. So answer is within 72 hours. 72 hours കഴിഞ്ഞിട്ടാണോ നമുക്കറിയില്ല, within എന്നാ പറയുന്നത്. So in between. So that is within 72 hours. That is the correct answer. Yes, Delighta. Okay, within 72 hours. Yes. And 10th one. What may occur if a gallstone passes out of the gallbladder into the bile duct and occludes the flow of bile? Okay, so this particular word occludes, which means blocks. വളരെ കോമൺ ആയിട്ടുള്ള വേർഡാണ് occlude, which means blocks. Okay, then gallbladder, bile duct, occludes. Yeah. What about 10th one? Very good, Binala. Your answer is? Yes. Yes, Lino. Within, yes. Within, within 72 hours. Okay? Okay, yes. Very good. Jaundice is the correct answer. So where is it mentioned? Jaundice, it's one of the complication. So that's from here. Okay, see, if gallstone passes out of the gallbladder into the bile duct and blocks. So that means occludes. Okay, so answer is jaundice. Yes. Then 11th one, people from which nationality are disentitled, ineligible for the management of gallstones? So nationality, disentitled, management. People from which nationality? Either country ana? Or which nationality? Yeah. Yes, Anila, jaundice. Okay, Star, Delighta, it is jaundice. Okay, Anu, Lenu, John Matthew, Suleka. Excellent, excellent. Yes, Reshma, jaundice. What about 11th one? American or Mexican? Any Americans? No. Very good. Native American or Mexicans? So answer should be, see, Mexicans നിങ്ങൾ separately എഴുതേണ്ട കാര്യം ഇല്ല, because Americans എന്ന് പറയുമ്പോൾ already they are included. Okay, very good. Yes, Binila, answer will be Native Americans. Okay, plural ആണ് വരിക, because Mexicans are already included. So native, ഇവിടെ careless mistake ആണ്, നമുക്ക് മാർക്ക് പോകാൻ ചാൻസ് ഉണ്ട്. So Native Americans will be the answer. Okay, അപ്പം നിങ്ങൾ എഴുതുമ്പോൾ Native American or Mexicans എന്ന് എഴുതണ്ട. Answer will be Native Americans. Okay, yes. A lot of correct answers. Okay, Binila, Gina, Anila, okay, John Matthew, it is Native Americans. Very good, yes. Where is it mentioned, Native Americans? It's from text B. One of the risk factors, and yeah, Native American or Mexican descent. So that means Native Americans. Okay, so answer is Native Americans. Okay, then next question, 12th one. The infection of which part is medically termed as acute cholangitis? Okay, the infection of which part is medically termed as acute cholangitis? So what is the correct answer? And I've seen this word in text C. Text C lana njan ee word kandadu. Yeah, see, acute cholangitis. So yes, so what is its infection? Answer enda bile duct aano? The medical term for a bile duct infection is acute cholangitis. Question enda choichikkunne? Read the question once again. Infection of which part is medically termed as acute cholangitis? Infection alladhu, it is in bile duct. Is it bile duct a part of the body or organ of the body? So is it bile duct? Answer correct ano? Bile duct ano? Just imagine, just think about it. Is it bile duct? Okay, so read that particular paragraph. Medical name for inflammation or infection of the gallbladder, okay, which is acute cholecystis. If a gallstone passes out of the gallbladder into the bile duct and blocks the flow of bile, jaundice occurs. If the bile ducts become blocked, bacteria can infect them. The medical term for a bile duct infection is acute cholangitis. Okay, so answer is bile duct, okay, which is from text B. Okay, sorry, text B, text C, yeah. So that is bile duct, okay. Then 17th one, the sudden and severe pain that make you sick to your stomach is called. A lot of correct answers. Yes, Mithun, Linu, Jeena, Anila, Jissa, Reshma. Okay. And what about 13th one? Sudden and severe pain that make you feel sick to your stomach is called. What is that called? Stomach. 13th one. Okay, it is a little bit lengthier answer, but you don't have to write that whole answer there. Either you can write, yeah, so either you can write what? Gallstone attack, or you can write gallbladder attack. Random code aydanda. Don't write both. Either you can write gallstone attack, or you can write gallbladder attack. Okay, yeah. Then 14th, the last one. What gets released into the blood in a large quantity if excess fat loss happens rapidly? So fat loss, rapidly, blood. Yeah. Okay, John Matthew, it's gallstone attack. Okay, dear. Yes, Jissa. Okay, Delita, gallstone attack. Okay, Reshma. Okay. Actually, one more thing. 14th question, answer നമ്മൾ പറഞ്ഞു, which is gallstone attack or gallbladder attack. പക്ഷേ അവിടെ ഒരു ആർട്ടിക്കിളും കൂടെ മെൻഷൻഡ് ആണ്. Okay, because in the question there is no article mentioned. Questionil ഒരു ആർട്ടിക്കിൾ പോലും mentioned അല്ല. But in the paragraph there is an article. See, this is called a gallstone attack. അപ്പോൾ അതുകൊണ്ട് A should be included. Compulsory ആണ് കേട്ടോ. നിർബന്ധമായിട്ടും A എഴുതണം. A is compulsory there. So answer will be A gallstone attack or A gallbladder attack. Okay. ആരെങ്കിലും A mention ചെയ്തിട്ടുണ്ടോ? Very good, Delita. Yes, a gallstone attack. Very good. Okay. And what about 14th one? What gets released into the blood in large quantity if excess fat loss happens rapidly? That means what? അതിനെന്താ നമ്മൾ പറയാ? That's called cholesterol, right? Yes. See, so what is mentioned here? Women and people AFAB are 3 times more likely to get gallstones than men. Then their risk peaks and declines with their estrogen and progesterone levels. Estrogen increases cholesterol levels while progesterone slows your gallbladder from emptying. Then next one, body fat. So body fat, which means what? എന്താ അവിടെ വെയിറ്റ് കൊണ്ട് ഉദ്ദേശിക്കുന്നത്? ദാറ്റ് ഇസ് ഫാറ്റ്സ്, റിലേറ്റഡ് ടു ഫാറ്റ്സ്. ഓക്കെ, ഫാറ്റ് ലോസിൻ്റെ കാര്യം ഇവിടെ പറയുന്നത്. സി, ഓൺ അതർ ഹാൻഡ് റാപ്പിഡ് വെയിറ്റ് ലോസ്, ഓക്കെ, റാപ്പിഡ് വെയിറ്റ് ലോസ് ലൈക്ക് ആഫ്റ്റർ വെയിറ്റ് ലോസ് സർജറി can also cause gallstones. Losing body fat quickly releases large loads of cholesterol in your bile. So answer is cholesterol. Okay, ഇവിടെ നിന്നാണ് ആൻസർ കിട്ടുക. നോട്ട് ഫ്രം ദ സെക്കൻഡ് പോയിന്റ്, വെയിറ്റ് എന്നാണ് കേട്ടോ. തേർഡ് പോയിന്റ് ഫാറ്റ് ലോസിൻ്റെ കാര്യമാണ്. സോ ദാറ്റ് മീൻസ് കൊളസ്ട്രോൾ. വെരി ഗുഡ്. യെസ് യെസ് ജോൺ, ഇറ്റ് ഇസ് കൊളസ്ട്രോൾ. Okay, so that's all about 14 questions. 15th one, having more of dash raises your estrogen levels and your cholesterol levels from the same thing. Same text ആണ്, from text B. So what is the correct answer there? എന്താ അവിടെ ഇൻക്രീസ് ആവുന്നത്? Having more of dash raises your dash. So what is it? Estrogen. Answer എന്താ? Text B. What is it? Estrogen ആണോ? Estrogen is already mentioned there, right? Body fat releases estrogen. So having more of it, which means body fat, not estrogen. കേട്ടോ, estrogen already question ഉണ്ട്. Body fat is the correct answer. It എന്ന് പറയുന്നത് ഇവിടെ body fat ആണ്. Okay, so answer is body fat. Okay, so that means body fat. Yeah. Then 16th one, the medical name for dash of the gallbladder is acute cholecystis. എന്താണ് മെഡിക്കൽ നെയിം ഫോർ ഡാഷ് എന്ന് പറഞ്ഞാൽ എന്താ? ഇറ്റ് ഈസ് ഫ്രം ടെക്സ്റ്റ് സി ഐ ഗസ്. കോളിസിസ്റ്റിസ് അവിടെ അല്ലേ മെൻഷൻ ചെയ്തേക്കുന്നത്? യാ ഓക്കെ. സി ദ മെഡിക്കൽ നെയിം ഫോർ ഇൻഫ്ലമേഷൻ. സോ ആൻസർ ഇസ് ഇൻഫ്ലമേഷൻ. Okay, it is inflammation. 17th one, gallstones are hardened concentrated pieces of dash that form in your gallbladder or bile duct. So answer endana? It's from text A. Gallstones are hardened concentrated pieces of bile that form your gallbladder. So answer is bile. Okay, 18th one, gallstones feel more severely after eating. Yes, okay Anila, bile aanu. Okay Sulega, inflammation this 16th one. Okay, bile aanu. Yes, yes Anne Maria, yes Jissa, Reshma, it's bile. What about 18th one? Gallstones feel more severely after eating when your gallbladder contracts, creating more pressure in your dash. In your where? Evidana. So 18th one, again from text A. Okay, answer is from text A. Text A ലാണ് ആൻസർ എടുക്കുന്നത് അല്ലേ? യെസ്. സോ ബൈലിയറി സിസ്റ്റം. You might feel it more severely after eating when your gallbladder contracts, creating more pressure in your biliary system. So answer is biliary system. Yes. Okay, Reshma and Delighta, Anila, it is biliary system. Okay, Linu, previous one is bile. Okay. Okay, so here it is biliary system. Okay, 19th one, the patient can for dash if zero occurrence of large pigmented of radio-opaque gallstones. Radio-opaque and something which I have seen in text D, right? Text D ലാണ് നമ്മൾ ആ radio-opaque എന്ന് പറയുന്ന വേർഡ് കണ്ടോ? Okay, so what is the correct answer here? അപ്പോൾ എന്താ ചെയ്യുക? Follow up will be there അല്ലേ? Yes. So answer will be follow up. Clinical follow-up, not just follow-up alla, clinical follow-up will be there. Not emergency LC, clinical follow-up ആണ് 19th one. Radio-opaque എന്നല്ലേ നമ്മൾ പറഞ്ഞിരിക്കുന്നത്. So, if it is 0, അതായത് no, S ആണെങ്കിലാണ് emergency LCയിലേക്ക് പോകുന്നത്. If it is 0, then you can do for what? എന്തായിരുന്നു? Clinical follow-up അല്ലേ? Yeah, clinical follow-up. Answer will be clinical follow-up. Hyphenated word aanu, hyphen should be there. And the last question, women are more likely to get gallstones during their dash roughly between the ages of 20 and 50. 20, 50 I have seen in text B lana ഞാൻ numbers കണ്ടു. Yeah, 20, 50. Okay, so what is the correct answer? Yes, during their fertile years, roughly between the ages of 20 and 50. So answer is fertile years. Okay, yes. Okay, വളരെ ഈസി ആയിട്ടുള്ളൊരു മെറ്റീരിയൽ ആയിരുന്നു, ബട്ട് സ്റ്റിൽ because of your carelessness there are chances for making mistakes alle. Okay, so let me know in the comment box, anyone with 20 out of 20? Yes, Star, Delighta, Reshma, Anne Maria, Anila, Benila, Blessing, okay, Sulekha, Jissa, okay, John Matthew, yes, Linu, fertile year, yes. So anyone with 20 out of 20? Full marks undo? Okay, Sulekha, 19 this time. What about the time? നമ്മൾ ടൈം മാനേജ്മെന്റ് ആണ് ഈ വീക്കിൽ നോക്കാമെന്ന് പറഞ്ഞത്. സോ വാട്ട് അബൌട്ട് ദ ടൈം? എത്ര മിനിറ്റ് എടുത്തു? You got 19 marks, and what about the timing? എന്ന് പറയാമോ എത്ര മിനിറ്റ് എടുത്തു എല്ലാവരും to complete this part A out of 15 minutes? Okay, Delighta 12 minutes and the marks 19 out of 20. Very good. Okay, then what about others? Okay, Linu, 16. 16 actually it's not enough, dear. Okay, but it's okay. So please keep it up. Okay, 17. Okay, Reshma, again it's not enough. We need 20 out of 20. Okay, yes, it's okay. You can try better. Okay, Jissa, 19, 30 minutes. Okay, Sulekha, 13 minutes. Okay. Okay, so yes, so that's that. So take care. Good day. See you.